Hi everyone, happy Wednesday. For those of you who don't know me, I'm Susie Leachy. I'm a certified health coach specializing in women's reproductive health. So I help women naturally balance their hormones through nutrition and lifestyle modifications. And last week I did a video on PCOS, which I have personally struggled with. And this week I want to talk about another women's health condition that I've also dealt with personally. And I know a lot of other women have too, and that is hypothalamic amenorrhea, which I know is a mouthful, so from here on out I'll just refer to it as HA for short. So I'll give you a quick overview of what it is, what some of the common symptoms are, how to know if you have it, and how you can treat it. So if you have any questions, feel free to leave me a comment and I will try to address those. And if you catch the replay and have a question, feel free to drop that in the comments or send me a message and I will get back to you. So to start off, what is HA, or hypothalamic amenorrhea? It's a condition in which the menstrual cycle stops for several months due to a problem involving the hypothalamus. So that's where it gets its name, hypothalamic amenorrhea. And the hypothalamus is the center of the brain and it's the area that controls reproduction. So I'll go over some of the common symptoms, and not all women will experience all of these symptoms, but these are some of the common ones. First would be, and this is something that all women do experience with HA, but absent menstrual cycles, that would be the amenorrhea, or it could also just be very light, infrequent bleeding. If you were to get a blood test and you have HA, it would show low hormone levels, so primarily low estrogen, follicle stimulating hormone, which is FSH, luteinizing hormone, or LH, and you would also see that your thyroid hormones are a little bit off, maybe still in the normal range, but trending toward the hypothyroid range. That's pretty typical. And then because of these low hormone levels, I'm so sorry, my cat is hitting my phone. Because of these low hormone levels, you might have symptoms related to these levels being low, such as feeling cold all the time, low libido, now it's shaking because my cat's on here, difficulty sleeping, fatigue, depression, anxiety, constant hunger, acne, brittle hair and nails, and even decreased bone density or osteopenia. So how common is HA? Well, about 10% of women in the US will develop HA at some point in their lives. So that's about 5 million women. So it's pretty common. And how is this condition diagnosed? So maybe you'll have some of the symptoms, but how is it actually diagnosed if you were to go to a doctor? So first of all, you would experience, as I mentioned, amenorrhea, or lack of a period, and you would show low hormone levels, as I previously mentioned, and other causes of absent periods would also have to be ruled out. So things like PCOS, a pituitary tumor, and of course pregnancy or menopause would be other reasons that you wouldn't have a period besides having HA. And then, as I said, presence of some of those symptoms that I talked about before. There's also something called a progesterone challenge, and that's when you're given a course of progesterone, and basically when you come off of it, it should induce a bleed. But if you have HA, you won't get a menstrual bleed because you don't have enough estrogen to thicken the uterine lining, so you'd only get a bleed if you were given a combination of estrogen and progesterone, like in the birth control pill. And so just as kind of a side note going off of that, the birth control pill can therefore mask HA because it causes your body to have a monthly bleed, so you don't realize that you actually wouldn't be getting a period on your own because you're not making enough of those hormones. It's just the synthetic hormones that are causing you to have this withdrawal bleed when you take those placebo pills at the end of the month. So this happened to me personally. I'd been on the birth control pill for a long time, so I don't know how long I actually had HA, but when I came off of the birth control pill, I wasn't able to cycle on my own, so that's how I ended up realizing that I had HA, but the birth control pill was masking it for probably a number of years. So what are the causes of HA and what are some of the risk factors? To sum it up in one word, it would be stress. So stress can come in many forms. Usually at least one of, but usually more than one of the following is present. So a low body fat percentage, that is a stress on the body, especially the female body. Under eating or not eating enough of a particular macronutrient, so typically not eating enough fat or carbohydrates. Over exercising, and that can greatly vary based on the individual. Some people can run marathons and they still cycle normally, their body's fine with it. Other people might run a couple miles a week, and for them that's enough of a stress for them to stop getting their cycle. So that it varies greatly. It could also be a sudden increase in exercise or a dramatic drop in weight. So even if you are exercising moderately, but you went from being sedentary to now exercising moderately, that sudden increase can kind of shock your body and you will develop HA potentially. And even if you, also a dramatic drop in weight. So even if you lose weight and you're still in the normal or even the overweight category, that drop in weight can also be a trigger for HA. And lastly, but this can be a big factor as well, mental or emotional stress. So there are those physical stressors that I mentioned, but mental and or emotional stress can also be a big factor here. So there's also a genetic component to HA, just like there is in PCOS, which I talked about last week. So some women are basically just more predisposed to developing this condition than others. Some women basically just have a more sensitive hypothalamus than other women. So some very lean, elite level athletes may still menstruate, while an overweight woman who just started a new exercise regimen may develop HA. So it's very individual. You might have a different sensitivity than another woman, so you can't really compare yourself or your situation to someone else. So now, how is HA treated? How can this condition be reversed? Well, as you may have guessed, you have to reduce the stress on the body that is shutting down the hypothalamus, and that's going to vary based on the individual woman, and that's also, of course, easier said than done. Reducing stress is kind of a buzz phrase, but it's not always easy. So the first step would be to find a way to relax, and that would be reducing or managing your mental and emotional stress. So maybe there are things that you can't eliminate, but learning how to manage or reframe those stressors in your life. Also, cutting out all intense exercise is usually something that needs to happen, at least in the short term, in order to recover from HA. And then eating more, including plenty of carbs and fats. So basically, in a nutshell, the female body is sensitive and it really wants to feel nourished, well-fed, and safe in order to be in a situation where it's comfortable reproducing. So often with HA, it's necessary to overcompensate a bit in the beginning to jumpstart your hormones and assure your body that it's in a state of safety and plenty. And this basically assures it that it has enough resources to create and sustain another human life in addition to your own life in your own body. So some women may also try various supplements or herbs, but really the only tried and true treatment is stress reduction through rest, relaxation, and nourishment. So there's really no magic bullet or magic pill for this. It's really those lifestyle factors and reducing the stress that caused your hypothalamus to kind of shut down in the first place, or shut down reproduction. So assuming that you implement some of these lifestyle changes and you have HA, how long does it take to recover from this condition? Well, some women do struggle with HA for years and years. Either they don't know that they have it necessarily, or they don't understand what it is or the ramifications, or they don't really know what it takes to treat it or aren't willing to do what it takes to treat it. So it can go on for a long time. However, on the flip side of that, the bright side is that the more that, I mean, no pun intended, but the more effort you put into reducing your efforts and resting, eating, and reducing stress, the faster you can start cycling again. So it can actually happen really quickly if you rest a lot, eat a lot, and really work on reducing or managing your stress. So that's basically the basic overview of HA. So that's all that I have for you today, if there aren't any questions. And again, if you do have any questions as you watch the replay of this possibly, just let me know in the comments, or you can send me a message and I will be happy to get back to you. I also want to mention that I have a private Facebook group. It's called Hormone Balancing, Fertility, and Beyond. So if you're interested in this type of content and you're not already a member of that group, I do invite you to join it. It's really a great group of women who are very supportive, non-judgmental, and I share a lot of information about women's health in there. So I'll post a link to that group in the comments. And also, if you liked this page and you want to continue seeing the content that I post, I do want to note that Facebook has recently changed its algorithms, and the content may not be showing up in your newsfeed as readily. So if that's the case and you'd like to continue to see my posts, you can edit your newsfeed preferences, and if you go under prioritize who to see first, just add Health Equilibrium by Susie Leachy, so that way you won't miss a post or video. I also want to mention that I have a free guide on my website to get you started. It's my top 5 tips for hormonal health. So I will post that link as well in the comments, but it is on the homepage of my site. If you just put in your name and email, you will receive that free guide. And if you want some support and someone to guide you in naturally balancing your hormones, I do offer free consultations. So I'll put the link to sign up in the comments as well. And as I mentioned, I personally struggled with HA as well as PCOS, which I talked about in my video last week. And so I know firsthand just how frustrating and challenging it can be to deal with these hormonal imbalances and some of the really awful symptoms and ramifications that these conditions can have. It really does negatively impact your life, so I totally get it. And especially if you would like to get pregnant either now or sometime in the future, it can be even more disheartening. So I've definitely been there, and I was able to overcome these issues with the help of a coach, and I really learned so much along the way, and now that's why I've made it my mission to pay it forward and help other women who are struggling and be that coach for them. So definitely don't hesitate to contact me if you need help or you know someone who does. You can feel free to share this video with them, for example. And lastly, if there's a topic or question that you'd like me to cover in an upcoming video, please let me know. So that is all. Thank you for joining me today, and have a great Wednesday.